For Vanessa Tantalo, her daughter's arrival couldn't come soon enough.
I just wake up and throw up immediately within getting up, and couldn't get off the couch. I'd have to stay home from work.
Like more than 2/3 of pregnant women, Tantalo had debilitating morning sickness and nausea, and she says Diclectin didn't help. Tantalo's experience isn't just anecdotal. This doctor has long questioned whether Diclectin actually helps his patients. His research team spent years trying to obtain clinical trial documents held by Health Canada. After signing a confidentiality agreement and examining the raw data, he says the evidence the drug works better than a placebo is slim to almost none.
Now I can't bring myself to write a prescription for this medication knowing what I know about it.
Prasad is not alone. Even though the FDA approved the drug, it noted Diclectin has a small treatment effect, while European regulators said it does not represent a significant therapeutic benefit over existing treatments. And a recent review by Health Canada also found the clinical trial was problematic and not definitive. But the Quebec-based maker of Diclectin insists the clinical trial meets appropriate standards, and the drug has been safely prescribed to 35 million women, and we found lots of pregnant women who swear by it. Prasad says that's normal, as symptoms often fade on their own.
I'm sure there are many women out there who can truthfully say that they got much better after taking the medication. The study suggests that it wasn't because they took the medication.
Diclectin seems to have divided doctors. The Journal for the Family Physicians of Canada agrees with Prasad, but the Society of Obstetricians and Gynecologists stands by the drug because it's safe, and there's nothing controversial about the active ingredients, a combination of vitamin B6 and an antihistamine found in common remedies like NyQuil. As for Vanessa Tantalo, her symptoms eventually disappeared without any medication. Vic Adopia, CBC News, Brampton, Ontario.
So you hear accounts like that, and obviously there's still so many questions that remain unanswered about Diclectin. So to try to get a bit of help with this, we're joined by Dr. Danielle Martin. Dr. Martin, I'm imagining pregnant women sitting at home right now saying, what am I supposed to do now?
Right, women and their doctors. You know, in a lot of ways, it reminds me of the common cold. Nausea and vomiting in pregnancy are so common, and they can be debilitating symptoms, and at times they can have significant complications. But as with the common cold, we don't really have very effective treatments. And so that's an uncomfortable place for women and their doctors. And if you look at the evidence on nausea and vomiting in pregnancy, you know, we've looked at ginger, we've looked at mint oil, we've looked at acupuncture, we've now looked at, you know, a wide variety of pills, and nothing seems to be particularly effective. And that's an uncomfortable place for women and their doctors. But women should know before they take a prescription medicine, and doctors should know before they prescribe it. If there isn't much evidence that it does anything, then it may be that the potential harms outweigh any potential benefit.
I know that, you know, people certainly of a certain generation will hear medication and morning sickness and immediately think of the problems with thalidomide. This is not that. It sounds like you're saying it's not going to help, but it probably won't hurt.
Right. So, you know, it's helpful for people to understand that when Health Canada approves a medication, as it has done in the case of Diclectin, they're primarily looking at issues of safety. And so there's not evidence coming to light about Diclectin being unsafe. But that's a different question from whether it's effective. And the bar for whether we prescribe a medicine to anybody, whether they're pregnant or not, should be much higher than whether it can be approved to enter the market. And it's a different conversation.
Right, so it's probably not going to be pulled off shelves.
I can't imagine that it would be pulled off the shelves, but I would expect that the rate of prescribing as a result of these new findings should decrease substantially.
Okay, Dr. Danielle Martin, thanks very much.
Thank you.